Last Friday I was in New York, and I was actually at the New York Stock Exchange because we had the honor to ring the closing bell because we were listed 30 years on the New York Stock Exchange. And it reminded me of the first time I went there about 20 years ago. And you still had the guys with the jacket, the brightly colored jacket, you know, writing on sheets and doing trades. And then about 5-6 years later, you know, it became quiet on the floor because people were actually trading from stations. And you looked at these stations and they had this beautiful advanced visualization to take in very complex information, visualize it so people could make the right trades. And now it was actually quite empty on the floor because 95% of all the trading is algorithmic trading. So that was the first thing that struck me and brought me back to my banking days. And then this weekend I was in Santa Monica, and I headed up Citibank's tech lab, also in the mid-90s in Santa Monica. And I remember that we really wanted to launch internet banking, but everybody advised against it. They said, well, you know, technology is great, but you know, nobody's ever going to do banking on the internet. That's not secure. And, well, you know where it went from there. And then, actually, I had dinner with my son, who works in LA. He works for BCG Digital Ventures. And he started explaining to me how they scan and look for places where they can be successful in digital ventures. And he said, well, we're actually looking at two things. We're looking at a fragmented consumer experience, and we're also looking at friction and waste in the value chain. And I said, boy, God, do I have an industry for you. So this brings me to my presentation. So clearly, I don't have a medical background, but I've seen change. I've seen dramatic change in the financial services industry that is already in the next wave of digital disruption. And also, you know, this morning I swiped my phone and actually had my cappuccino charged to my account in Amsterdam sub-second. So, and then I'm here talking about healthcare. So I think we have a tremendous opportunity to address these both things. We have a tremendous opportunity to create a very compelling patient experience, or a consumer experience, if you will, that allows people to take control of their own health and to be supported by multidisciplinary care teams. And you cannot be just supported by your GP and a specific specialist. You have to be supported by teams that deal with the complexity of your medical conditions. And that's what we're going to talk about today. So you probably have seen this slide many, many times. But there are some real profound changes happening in the market. You know, just in the US market, if you look at what's going on, every 4 days, another hospital group gets consolidated into an integrated delivery network. CVS just made a bid for Aetna. All the big IT players are getting into healthcare. But nothing will fundamentally change until we truly move towards population health and a system that gives an incentive to create better outcomes. Of the about 2,000 metrics that drive care today, only 7% are based on outcomes. Only 2% are patient reported. So the first thing we got to change is make sure that we publish those outcomes, that there's transparency in where you get the best care. And obviously where you get the best care at the lowest cost, because care can shift to different settings. Care can shift to where you are. Care can shift to where it's best provided in a 24/7, always-on world. You know, when I was at Citibank 20 years ago, the slogan was, the city never sleeps. So we introduced the concept of 24/7 banking. We introduced the concept of omni-channel access. You know, maybe it's time that we think about those models for healthcare as well. And I think there are tremendous opportunities to do that. I think there are tremendous opportunities to leverage technology to craft these completely new dynamic care pathways that take into account your individual needs. These pathways that are supported and enabled through technology. So there's a couple of core converging technologies that are at the essence of this. So obviously cloud. If we want to make sure that we collect data and we normalize it and we make it longitudinal, it has to be in a place where it can be accessed anywhere, 24/7. If we want to connect those devices, it should be like a point of sale terminal. It should be secure. It should be connected to a 24/7 network around the globe. Internet of Things, Internet of Medical Things. And artificial intelligence probably brings the biggest promise to deal with the complex emerging systems that are we. So every day, every discussion we have, what we eat, our history, all determines what our health is going to look like in the coming period. Sensors everywhere. Sensors everywhere will change the way we engage. And what we're looking at Philips is continuous health tracking. The only place where we do continuous monitoring today is actually in an intensive care unit. So what if we can do ubiquitous monitoring? What if we can track all your vital signs and do fall detection in a little patch that you stick onto your heart? What if we can do that wherever you are? What if we can bring that advanced visualization, which we did 15 years ago in financial service industry, to the complex information that can be derived from images, from pathology, from genomics, and mash that up to give that full picture of you? What if we can monitor not just for absolute values, but for contextual values that create the relevance for you and your medical condition? What if we can glean your biomarkers from a pathology image? For 125 years, pathologists have been staring through microscopes. That has changed. What if we can quantify immediately what we see on an image? So all of this is not in 10 years. All of this we're doing today. And what's the hard part? The hard part is changing the clinical pathways that embrace this. The hard part is finding the reimbursement models that actually give an incentive to create those better outcomes. So I mentioned artificial intelligence. Artificial intelligence you heard about, I think the speaker before me did an excellent expose on what it is. But it deals in probabilities. So unlike traditional IT, which is if then else, this deals with the complexity of data. In our ICU system, we now monitor 2,000 patient data elements simultaneously to assess the health of the key organs and to assess the health of the person and to predict deterioration and to identify the right interventions at the right time. So what feeds that? First, it's data over time. And I'll come to that later. Data over time that truly represents you and your condition. It embraces smart devices that recognize you and that give more information about you, that can create a closed loop about your health. What we call ambient intelligence, an environment that adapts to you. Smart workflows. So today, many of the workflows in a hospital or at your doctor are kind of fixed steps. But that's not reality. Reality is complex. Reality is things change, events happen. So how can we create those dynamic workflows that take into account the acuity, the importance of the intervention? And then lastly, how can you do that into a real ecosystem? So what we're looking at is how this can help us create better care flows, create better understanding of the patient, but most importantly, do a very precise diagnosis that leads to the best therapy that fits with the individual needs of the patient. So where do you start? And again, this is a lesson I learned from Citibank, because 20 years ago, we took 50 million customer records and we started analyzing customer needs. And instead of having around 30 products, we ended up with about 2,000 products, because each of these product portfolios were tuned to the needs of those customers. So you start with the needs. You start not just with the clinical needs, behavioral needs, socioeconomic needs. And if you then stratify your population, and you identify those patients that have the specific needs for support, then you craft the programs, the clinical programs, the social programs, around those needs of the customer segments. Nothing new. Consumer industry has been doing this for 20 years. So maybe it's time we bring this to healthcare, and not just purely clinical programs, because we heard earlier that's not just clinical aspects that drive health. It's behavioral aspects, it's socioeconomic aspects, it's what you eat, how you sleep, your stress, your drugs. So if we start with this, we can start identifying where we can have most impact on certain groups of patients, like elderly people with 5 or 6 chronic diseases who are on 6 or 7 medications and who are actually having issues dealing with their health. We can apply this to acute care. So we can use artificial intelligence to see these patterns and start predicting deterioration. We can start seeing cardiac arrest 48 hours in advance, so we can intervene. We can optimize length of stay. We can find the right transitions. And we're doing that today. A huge promise for precision medicine. And it's for the first time that I talk to customers who say, I'm going to actually combine 3 departments into one. And we call it advanced diagnostics. We're going to take a radiology department. We're going to link that to our pathology department and our genetic department. So now we can start seeing, even if we look at an image, we identify a cancer lesion, we can look at a prior image, we can quantify the changes. We can start looking at the edge of the lesions and start seeing if there's entropy around the edges, because that gives a sense of the aggressiveness of the cancer. We can pick out the tissue and pick that out through our non-invasive guidance, pick out the tissue, put it in the pathology machine, find the biomarkers, the structure of the cancer, identify the 10 or 15 cells that are the cell types that are the drivers of the cancer, do the genomics on it, and then mash up that information to find the right therapy. And then, when applying that therapy, increasingly using image-guided technology. So, the place where we sell most of our cath labs, you will never guess, is actually in shopping malls. Because you have these new setups where, groups of cardio intensivists set up their own cath lab close to where patients are. You make an appointment online, you come in, insert a stent, and you walk out the same day. And that's the combination of very, very smart devices, catheters that go into your body, that sense the shape of your arteries, that have ultrasound so that they can look at your body from the inside, and that can apply chemotherapy on the spot, or open up a valve, or drill a hole in your back using augmented reality. This stuff is real, is here today. So what is our next step? So we're beyond Internet of Things. We're really talking about ambient intelligence. And this is a term that Philips coined 20 years ago. And it took about 20 years to get us here. But it's really the idea that the intelligence is in the things around you. The intelligence is in those things that are aware of you. So we set up a NICU lab, so for the most fragile of babies that are prematurely born with conditions. We put the tiny baby in a little crib with a camera that's doing the vital signs sensing. Actually, if you open up the crib will know the baby sleeps. It will dim the light. If the nurse comes in, the crib will know, and automatically the screen will display all the relevant information for the nurse. So this is a very non-intrusive, embedded environment where everything understands about you. It recognizes you. It will configure to your needs. So yesterday I visited our factory here for our ventilators. Today our ventilators are not only giving you, the right amount of air, they're actually analyzing the way you breathe. And they will automatically configure to you and your condition, and they will send information about you. Our sleep apnea devices find the patterns of your sleep and give you guidance on how to better sleep while doing their therapy. So it's adaptive. It anticipates your needs. And lastly, increasingly we'll converse in a natural way. So maybe we're at the peak of what a smartphone does today, because in the next couple of years that intelligence will just be around you and you converse with that intelligence. And no longer will you need your phone to do everything you need. You know, we're building an ultrasound system that is becoming autonomous. So instead of autonomous driving, we're talking about autonomous ultrasound. Why? Because only 300,000 people in the world today know how to operate an ultrasound machine. Now, what if it gives you haptic feedback? It deals with AI on distorted images and create a very crisp 3D lifelike image. So we're already there. We're creating a lifelike 3D image of your fetus. But now your doctor can carry an ultrasound instead of a stethoscope. You know, emergency care can have an ultrasound that can do real-time analysis. So the concept we're working on is the digital twin, but it's not like your snapshot of you. It's actually a 4D digital twin. You can almost call it the movie of your life, because we want to understand who you are, where you're coming from, and your genomic code will tell you a lot about your previous generations. Images can tell you a lot about your life, but also there's a whole lot of other information that's highly relevant and truly understanding who you are and what you need. So therefore, we can be much more precise in prescribing what works best for you, what therapy, what care path would be most appropriate for you. So I'll show you how we're doing this. So first time we show this video.
Imagine a future where personalized healthcare will provide every individual the right type of care, in the right way, and at the right time. A key enabler for this will be computational biophysical modeling. Let's look at an example of how this plays a significant role when Dr. Sullivan, a cardiologist, is treating Mr. Burke, who has been diagnosed with atrial fibrillation. Although AF is a highly prevalent disease, it can be complicated to decide on the individual treatment strategy for a patient like Mr. Burke. This is where biophysical modeling proves useful. It starts by using Mr. Burke's medical data to create a patient-specific biophysical model, including a virtual version of his heart, which looks, behaves, and reacts just like the real one. This biophysical model, combined with cloud data on similar cases, allows Dr. Sullivan to select ablation as the therapy with the best possible predicted outcome for Mr. Burke, both on the short and on the long term. Dr. Sullivan carefully plans the procedure by simulating various ablation scenarios on Mr. Burke's virtual heart model. She is then able to select the one with the optimal computed result. The chosen ideal scenario forms the basis for real-time intervention guidance. During the procedure, all taken actions, as well as any unforeseen situations, are processed real-time into the biophysical model to redirect if necessary. As a result, Dr. Sullivan could treat her patient at the right time, in the right way, with the best possible outcome. This is one of many potential cases in which biophysical modeling forms an essential building block for an optimal healthcare system. From personalized diagnosis and therapy selection to procedure planning and guidance tailored to the patient's physical characteristics, medical history.
So, you get an idea of what we're doing here. We're truly creating these deep understanding that drives right diagnosis and treatment, right care pathways, becoming way more predictive, more precise and personal. We're looking at this because the knowledge is now in the system instead of just in the heads of specialists. It can be shared across the globe. We can provide access to those 2 billion people who don't have access yet, purely through technology. We can create that seamless patient experience through the principles of ambient intelligence. And we can use AI to turn complex data into truly actionable insights 24/7, every day. And we truly believe that this will create a better world for all of us. Thank you. Thank you.
Thanks, Jeroen. One last question. How would you say, so we mentioned that you partner with startups as well.
Yeah.
What's the key way for folks to partner with a larger organization like yours?
Yeah, so what we've done is we set up an organization called HealthWorks, and our entire role is managing the ecosystem. So what we've done, we set up 4 innovation hubs. So one in Cambridge, Massachusetts, which is kind of the hub of MedTech. One in Eindhoven, because that's where Philips was born. And they claim to be the smartest city in the world, by the way. Contestable. Bangalore, India, because we have a huge software capability there. And then, of course, Shanghai, because we see tremendous opportunity in China. So, for instance, we're working with some of the largest cancer institutes that are actually networking 100 cancer hospitals into a full-fledged AI system. So don't rest on your laurels. It's going to be big.
Great. You're really connecting dots.
Okay,
Thanks. Cheers.
Thanks. Bye.
All right.